How do I know if I'm doing a Kegel correctly? Hi, welcome to our Ed Talks, little snippets of education to help you heal and feel empowered. I'm Justine Calderwood, pelvic floor physical therapist and birth recovery specialist. This is a great question, and I want to show you a really simple thing that you can do to know if you are contracting your pelvic floor or doing a Kegel or a Kegel, however you want to pronounce it, if you're doing it correctly. So you probably have heard of Kegels. If you have any type of pelvic floor dysfunction, if you feel like you have some weakness, if you've had a baby, there are a lot of reasons that people have heard about Kegels and they want to do them at home and they're not quite sure if they're doing it correctly. So that might be the boat that you're in as well. So I want to give you just a little tip. I use this with my patients, and in fact, today when I did this with a patient, she's like, I never heard it said that way. So what I would do if I were you and you want to know if you're doing it correctly is take a look. So I'm going to show you the female pelvic model here. So this is the pelvis as we're looking at it from the front. So if you are lying on your back, which I suggest you do this, lie on your back and get a mirror so you can see down below. Now, if you are like this on your back, the pubic bone would be here and the tailbone underneath. So you can see underneath here, we have the vaginal opening here and we have the rectum there. And up here we have the clitoral hood. So what you're going to look for to know if you're doing a Kegel correctly is a wink and a nod. So what that means is you're going to look for a wink down here at your anus. It's going to close, so it's going to wink at you. And you're looking for the clitoris to nod down, meaning it's just going to come down towards the vaginal entrance. So get your mirror, and what I would suggest you do is start with a little breathing. And when you do a Kegel, do it on an exhale. So I always tell my patients, as you inhale, inhale through your nose, bring the breath down to the space, but relax. And as you exhale, exhale out through your mouth and try to do a Kegel where you're contracting the pelvic floor muscles, which is much like if you were going to the bathroom and you needed to stop urinating for whatever reason. So give that a try. See if you can see the wink and the nod. If not, you're probably not doing it correctly. There's other ways that you can double check this. I think this is the most simple way, but you could definitely say insert your finger into the vaginal opening and see if you can squeeze around it. You can definitely insert something in, so like a sex toy or penis, and you can see, can you contract around that? So those are some good tips as well. If you are having a hard time doing a Kegel correctly, I'll give you one cue, and this actually helped for my patient this morning who was actually bearing down when I just asked her to do a Kegel. I didn't give her any other instructions, but she was actually bearing down instead of contracting and making the pelvic floor muscles work. So the one cue I gave her was bring your anus to your vagina. Or another cue is act like you are, you have bad gas and you're in front of somebody you want to impress and you don't, for the life of you, want that gas to pass out. So when you do a Kegel, you're closing down your anus as well, but bringing that up, kind of thinking about bringing it up towards the vaginal opening can help that to contract a little bit better. Now, if you are struggling with any type of pelvic floor issues, and this video caught your attention for whatever reason, and you want a little guidance, I would love to be that person for you. Reach out. I'd love to do a phone consultation with you or hop on a Zoom call for a discovery session or sit down in person. Basically, all that is a consultation with myself at no charge, and there's no obligation in any way with that. But I'd love to hear what's going on, and we can see if we together can come up with a solution. You can start on my website at healingspotpt.com and fill out the form for a free discovery session. All right, see you on the next Ed Talk.